morning, everyone. Thank you for your nice. I feel like I'm in the stand-up comedy, right? In the Jerry Seinfeld. It looks like the entrance of Jerry Seinfeld. It's just need the bass drummer. Okay, so what would you do? Season 3, episode 8. I don't know what season number of the episode. It's 8? No. I don't know. 9. I just put 8. 9. Episode 9. Episode 9 of the sequel. Okay. So today we're supposed to have oral hygiene. So you might have a lot of oral hygienists waiting for this. But Pedro Roberto just fainted because he was so nervous that he didn't want to do it. No, just kidding. He has a big event tonight. He's going to have the first ITI study club dental hygienists. Okay, so if you want to come join us tonight here in International Advanced Dentistry. But we move on to episode 8. First of all, Marisa, don't forget, are you following us?
Yes.
Yes? Did you click on the bell? You have to click on the bell to receive the notifications, okay? So, guys, click on the bell to receive the notifications, okay? This is a YouTube channel. We should have followers, okay? So, please click. Come on. So, today, we have another case that our team here solved, okay? Here we are. This is me here. Wait. This is me here. This is me here. This is Ron here. This is Elena here. We should take a picture with Marisa also and place it here. We do Photoshop of the face of Marisa, and then we place Marisa here. What do you think? Yes. So we had a very nice, interesting case a couple of years ago. This was probably 2020 or 2021. So this young lady appeared to us and said, Dr. Chen, I'm ready for you. Where have you been all my life? Right? So she arrived to this point. This is a class, I call it the menu 4. Okay? It's normal 2 implants for 4 teeth. Okay? It's like a menu. If it was on the bottom, normally it's menu 2. It's 2 teeth for 2 implants for 4 teeth. We call it menu 2. I don't know why. Menu 2, menu 4. So this is a menu 4, a classic menu 4. So the decision here, there's no tooth, so there's no extractions, there's nothing. The only decision that you have to make is where are you going to place these implants, okay? And this is a very interesting topic, and it's a very interesting debate for the last 20 years, okay? And it still is. It's not a final answer that we're going to see here. So I pass you the CBCT images on the case, okay? This is a traditional horizontal severe bone resorption. We still maintain the vertical. So this is a classic case where you have to do guided bone regeneration with anything that you want, bone, autogenous bone, titanium mesh, GBRs, whatever you want. But for here, the question was, where do you place your implants? And by inference, the number of implants that you're going to place to solve this case. So, in the first question, I put implants in position 1 and 4 on the lateral incisors. Okay. Option number 2, I place implants in position 2 and 3 on the central incisors. Okay. And you were laughing. You probably vote on it. You were laughing. No, you did vote on this one. No. Okay. We'll see. Then option number 3 was I place implants in every spot. Okay, 1, 2, 3, and 4. Okay, we're gonna see. And final, we're gonna place implants in number 1, 3, and 4. Okay, 3 implants in this position. Okay, it could have been another to, for example, 1, 2, and 4, but the idea is 3 implants. Okay, distributed over this area. Okay, let's have the results. Half of you would place on number 1 and number 4 position, the classical lateral approach, okay? And 55% normally represents what we see in average in universities, in the meetings, in everywhere. But I was a little bit worried because last night I went to check and almost 90% would place implants in this position, which for me was awkward number, okay? So, but 35% of you said, no, 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 I will not place, this one? Okay. 35% of you said, we're going to place on central incisors. We're not going to place on the lateral incisors. I don't want to care about you 55%. I'm going to place on the central incisors. And Berta is going to explain to us why. And no one voted on number 4, 3 implants, okay? 3 implants, okay? Which for me was a little bit awkward. But I kind of understand because this is an Instagram post. There was not much information about the biting, the skeletal position, how is the masseter muscles, how is the protrusion of the teeth. So I kind of understand. So let's see, what did we do, okay? But first of all, a little bit of mechanical engineering problems here, okay? So imagine this is your area that you're going to work. So number 1 represents the lateral incisors, number 2 the central incisor, number 4 the lateral incisors. Okay, Marisa, are you getting this? Okay, you get this, okay? So now you have to decide. You have to tell me where is the position, okay? So the classical approach, if you draw a line through the central incisors, okay, then one would say that, no, I'm not placing implants on the central incisors because then I will have a cantilever of the lateral incisor, right? These ones. And they will be in danger because I heard in the literature and everybody saying to me that we should not have cantilevers. Cantilever is bad for your health. You're going to die if you do cantilever, okay? If you place the implants on the lateral incisors, then the majority of the people said, I place on the lateral incisors because in that way I don't have any cantilever, okay? Right. So when you bite an apple, okay, what is this that you see here? It's a big anterior cantilever, okay? Much because the implants are here, and when you bite, all of this is a cantilever. It's an anterior cantilever, okay? So in this situation, if you're trying to run away of a cantilever, you're creating a bigger one, okay? This is not just a pontic. This would be a pontic if the mouth was a straight line. But because it's an arch, you have an anterior cantilever of this part, okay? So you're creating also a stress and cantilever way to this implant, okay? So when you do your protrusion, okay, where you do your protrusion, Berta? On the central incisors, okay? Almost everyone does on central incisors, okay? And your lateral approach, where you do your lateral excursions. Draw, where you do lateral excursions. On canines, on number 3, of course. That's why it's a prosthodontist, okay? So in either situation here, the lateral incisor is never in function, right? Never. The guys from Prosto know this. So if they're never in function, why the hell are you placing implants in teeth that are not going to have function? It's a nice question, right? Okay? It's a nice question. So let me explain a little bit to this. So if you have here canines, centrals, and lateral incisors, okay, your area of dangers is on the protrusion on the central incisors. The lateral incisors never touch, and the lateral excursion is on the canine, right? Okay? So if you do a line here, you see that you are not seizing the advantage of having a big structure on the central incisors to hold on that excursion movements, okay? So, but if you cross and you place an implant on the lateral and the central, you're diminishing the anterior cantilever and creating a lateral cantilever, which by itself doesn't have any impact on occlusion, okay? So now placing implants on number 1 and number 3 would actually not be a bad idea, okay? And if you ask the surgeon, this is only pure mechanics prosthodontics, if you ask the surgeon, where is the area more favorable to place implants, it's on the central incisors, right? Because the lateral incisors almost never have horizontal bone. That's why you place 3.5, 3.3, right? And sometimes you have to do big GBRs because lateral incisors cannot afford bigger sizes, okay? While on the central incisors, normally you're placing 4.1, 4.5, or even higher, okay? So that's an area more favorable, more bone-to-implant contact, more structure of implants to hold this part over here, okay? While the lateral incisors, sometimes they're in danger, okay? And we published this almost 16 years ago. I'm getting old.
Wow.
16 years ago, we did an article in Portuguese that is the guidelines to place the implants on this position. Based on what? Okay? Based on biomechanics, on the holistic perspective of the person, okay? If he's a grinder, a chewer, the masseter, the head position, the posture, the musculature, the skeleton part, together with also the biology, okay? And if you want to read, it's a very nice read, then just put it on the Instagram there. They said, I want to read, and we send you the article, okay? And as you can see, there's advantage, disadvantage, indications, and contraindications on the three positions of the implants. With 2 implants, with 3 implants, and 4 implants, okay? Yes, you can place 4 implants, okay? You can place 4 implants, okay? If the area allows it, okay? If the biology allows it. Because then you have to match the biomechanic, the prosthodontic part, with what? With what? With what? With what? Can I place 4 implants with less than 1 millimeter apart? No. So you have to match with biology, okay? With biology. Of course, if you don't have space to place 4 implants because they stay less than 1 millimeter apart, you're not going to place 4 implants, okay? Even if the case is very unfavorable on the biomechanical part, okay? So the biology is very important. And then, my friends, you have to go to the literature. You have to read what happens between the interproximal bone between 2 implants. You have to know what happens to the interproximal bone between implant and tooth. And you have to also see between implant and pontic, okay? That's the Salama, Tarno, all this literature. So the combination of this will allow you to fulfill the case, okay? So it's just not, let's place every time 2 implants on the lateral incisor. That does not happen, okay? So that's why, again, that this decision of the amount of implants and where to place those implants is a prosthodontically driven decision, okay? Once again, it's the prosto who's in charge, okay? We're not in charge. We have the bigger cars, okay? And we have a lot of money, the surgeons. But the prosthodontists are the ones which in charge, okay? So just go ask them where they think that this implant should be and how many implants for this case, okay? And then we execute. So in this case, it's easy. Now it's easy. Now it's execution. Now it's surgical technique. We just create a guide for a pilot drilling procedure, okay? This is a very narrow ridge. In this case, we went for the lateral incisors because the case biomechanically was better and we didn't have any advantage on the central incisor. As you saw on the CBCT, everything was resorbed, okay? So in this case, we placed 2 implants on the lateral incisor. Whoops. Okay. So here you have the implant placement, okay, with guided bone regeneration. This is a classic GBR technique described by Chen and Buser in the year of 1992, okay? So this is a classic literature. So we have here the guided bone regeneration. And then we send it to orthodontics, okay? We send it to orthodontics so the orthodontics can now place the teeth in the correct position. We did a first provisional trying so she can wear during the orthodontic treatment, okay? And then it arrives to the place of the final impression, okay? And here you can see already the guided bone regeneration, the soft tissue sculpture, and what you see here, okay, is biology at work, okay? Why is this papilla shorter than here? Anyone? Bone. Because there's interproximal attachment of the tooth. So the papilla comes from the natural tooth. So you have here a beautiful papilla, but then you see here that is not such a favorable papilla. Why? It's implant to pontic. The Salam article, okay? And here the central incisor is the part where you see on Instagram the beautiful sculpture of the tissue. Why? Because this is the most favorable part. This is the interproximal papilla. The nasopalatine nerves comes here. So if you're an average prosthodontic, this is the papilla where you're going to shoot your Instagram photo, okay? You always have success. You never see a photo of this papilla. Never. You always see a picture of this papilla. Wow, you're such a good papilla. It's almost inevitable to fail this papilla, okay? Except if you have a very anatomical defect. This is the picture that you want, okay? And then you multiply for the rest. But now think, if you place the implant here and here, okay, what happens to these interproximal bones? Or if you place an implant here, 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 and here, what happens to this biology, okay? So is this items that you should have in mind when you're creating the menu for, okay? Always the biomechanic in contrast to the response, the biology response to this implant, okay? So then we had a little fun with the smile cloud, okay? We put this on the smile cloud, we try we did a couple of teeth setup, virtual teeth setup, and then eventually we get to a point where we finish our ceramic part, okay? Then she will finish the orthodontic, the occlusion on the back, and she will go for the rest of the work. But for here, you can see we solve it with 2 implants on the lateral incisor, like 55% of you said, but not always and never, okay? There's a reason behind of this choosing of implants, this choice of implants, and this choice of position, okay? So, thank you very much. Next week, I don't know who it is. Who it is? It's probably Pedro. It's probably Pedro. Pedro is next week. You have 1 week to prepare yourself. Don't forget to follow us. Don't forget that this week we're going to have the Master Beginner of Implant Dentistry. Just type there on Instagram also if you want to have more info. And we'll see you next week.